Good evening, everybody, and thank you for joining us for tonight's webinar, which is being hosted by AHDB Beef and Lamb and Dairy. My name is Katie Thorley, and I'm Knowledge Transfer Manager for Beef and Lamb within AHDB. I'm delighted to bring you tonight's webinar on reducing pneumonia risk in beef and dairy calves, the challenges and solutions. Our presenter this evening is Colin Penny, who is a livestock veterinary consultant for Zoetis. Colin will explain the main pneumonia challenges on farm with practical advice on how cases can be prevented to reduce antimicrobial usage and maximise productivity. The plan of action is Colin will run through a presentation and then there'll be time for questions at the end. You will all stay muted throughout the webinar, but if anyone would like to ask any questions, please type them in the box on the right-hand side of your screen, and I will endeavour to ask all the questions to Colin at the end of the presentation. We have lots of people registered for tonight's webinar, and I'd like to thank Elena, who's working behind the scenes to keep everything running as smoothly as possible, to hopefully have as few technical difficulties as possible. So without further ado, I'll pass you over to Colin for his presentation.
Thanks very much, Katie. So hopefully everybody can see my screen clearly. And just as another small introduction to who I am and why I'm doing this webinar, I'm a farm animal practice vet. I graduated in the dim and distant past in 1985. I worked for about 5 years in Lockerbie in southwest Scotland in a big farm practice, and then I went to work at the vet school in Edinburgh for 20 years. During that time I was looking after the farm animal teaching practice in that part of the world, and then about 6 years ago I changed jobs to work for Pfizer as a livestock vet consultant, and now that has become Zoetis. So that's just a bit about who I am, and just to introduce the talk plan this evening, what I'm planning to do is start off just talking a wee bit about the scale of the BRD problem that we have in the UK, and then we're going to talk a bit about cost benefit of control, because that's often the thing that we don't maybe talk or think enough about. Then we'll go on to the causes of BRD, and I must at this stage actually just say that I'm going to refer to pneumonia as BRD, so just to save swapping between nomenclature, but BRD, just a general term, bovine respiratory disease, which really covers all the different types of pneumonia that we get. So excuse me if I keep just calling it BRD, but it's probably easier to refer to it as that. So we're going to talk a wee bit about the causes, and then we're going to go on. The main part of the talk is really going to be, I'm going to describe what I'm calling a three-pronged approach to tackling BRD, because BRD is such a complex disease that you need to have a kind of structured approach to it. So I'm just going to maybe give a slightly different angle on it than you may have heard before, how I would approach a farm that's having recurrent problems with pneumonia. And then we'll finish off with a couple of dairy and beef case examples to try and kind of make the point of how you might put that three-pronged approach in place on your farms, and then hopefully plenty of time for questions. So what is the scope of, or the scale of the BRD problem in the UK? And it's interesting that we actually don't have much good, accurate data, because there's very few farms that record accurately every case maybe of pneumonia that they treat. And even if you were recording every case that you treat, it's quite hard to get that data extracted from your farms onto some kind of national database. So we really actually have very little accurate information. So one of the best surveys that's been done recently was this dairy youngstock project in Wales, and you can see there were 75 farms that took part in that survey, and it provided quite nice accurate information on how many calves, specifically heifer calves is what they were surveying, were treated for pneumonia over the study period. So you can see in this study, which is quite recent, they recorded around 20% of all heifer calves on these farms were treated for pneumonia. And another interesting fact that came out of it was the percentage of farms that were vaccinating against pneumonia. You can see there it's about 33%, and that actually fits quite nicely with some work I did about a year or two back, where we looked at the number of respiratory disease vaccines that were sold in the UK, of all the different kinds of vaccines that are available for young calves, and looked at that against the population of UK youngstock under a year old, and it came to a pretty similar finding that it's probably less than a third, or about a third at the most, of all our calves in the UK are vaccinated against pneumonia. So we'll come back to that, whether we should be trying to increase that. So dairy farms we know it's common, pneumonia. On this study, 20%, but I suspect, unfortunately, in a lot of farms, there's more than 20% of calves treated in a year. So what about beef calves? Well, the beef calf pneumonia incidence, again, very hard to get any accurate, reliable figures, so it tends to, a lot of it be anecdotal, or you speak to farmers and vets in different parts of the country, and it will vary widely. So I would say it's obviously going to be higher risk on farms that are purchasing calves regularly, calf rearers, where there's mixing and market purchase calves, as opposed to, we have, certainly in the borders where I've worked for many years, we have a lot of beef suckler herds that are fairly closed units, and with a combination of good management, vaccination, they've virtually eliminated BRD. And so it is definitely possible to have farms where you have very little calf pneumonia, but that isn't always the case, unfortunately. So we're going to talk about how you can reduce risk if you're not in that category. And the good thing is, even though you might be surprised by this, if you speak to a lot of vets, certainly in Scotland where I work, if we look back to the amount of antibiotics that we were using to treat beef calves in particular, maybe 10, 15 years ago, it was a lot more. We have a lot of farms that I can remember in the sort of late 80s, early 90s, it was absolutely predictable. You would go to the farm between Christmas and New Year and inject large groups of suckle calves for pneumonia, late December, early January time. When these farms started blanket vaccinating in the 90s, a lot of that ceased. We still do have farms where you have to go in occasionally and treat whole groups. I think that has been greatly reduced in many units since the introduction of vaccine. So what are the, if we're only vaccinating maybe 30% of our farms in the UK, what are the barriers to vaccination or BRD control? And one of the things that often gets talked about is, well, it's too expensive. So we're going to come back to discussing that, what is the cost benefit potentially of pneumonia vaccine? Because interestingly, if you speak to farmers, and many of you online, hopefully are farmers who are using vaccines, if you ask people, since you started using pneumonia vaccines, have things been better? Anecdotally, almost always people will reply, yep, we get less cases of pneumonia, and even if we do get cases, they're easier to treat, they respond better to treatment. So that's a common anecdotal finding. But I think what we need to focus on is not just reducing the number of cases that you treat, but reducing what I'm going to call this subclinical damage, or BRD damage, which I think can be just as significant as the treatment cost. So let's have a look at what I mean by these subclinical losses. So if we say that the tip of the iceberg is the ones that you see when you treat, what do we mean by this degree of loss that's under the water, so to speak? And it's really all about production loss. So the true cost of BRD is a combination of your treatment costs and production loss. And there's been some quite nice work done now in the UK looking at the potential daily live weight gain reduction in animals that appear to be healthy at the time of slaughter, but when you look at the lungs at the slaughterhouse, you can see here this is what a healthy lung should look like, nice kind of salmon pink throughout the whole lung, as opposed to this lung where you can see there's what we call consolidation of the front part of these lung lobes. Now, what that does, and the pig guys know this because they've been doing lung scoring for many years, is that if you have animals that have any degree of consolidation, in other words, they don't have fully functional lungs, it will reduce their growth rate at a level that might not be obvious unless you're weighing animals regularly and comparing ones at slaughter that have had this damage compared to healthy ones. And this is a kind of typical result you'll get. This study was done a few years back in some beef cattle that were followed right through to slaughter. And you can see that the daily live weight reduction was estimated at between 72 and actually over 200 grams per day, depending on the lung scores that the cattle had. And also, the ones with the more severe lung scores tended to be downgraded. The carcasses were also downgraded, so there was a double loss there. So you can actually quite quickly then do a kind of fag packet, we'll call it, calculation for what this subclinical lung damage might be causing in say, beef cattle. So let's say we take calves that have had a degree of lung damage. It's going to give you, let's say, a moderate level, 150 grams per day average daily gain reduction. If you apply that daily live weight loss over a 240-day finishing period, then animals that are suffering that degree of live weight reduction, they'd end up 36 kilos below the target kill weight, in other words, compared to unaffected pen mates. And that's going to cost money, so because if they end up below target kill weight, potentially you've got them on your unit up to an extra month, 30 days, let's say, extra finishing costs to get up to that extra weight, the target weight you want to get them at. And if you look at the stock take costings which are produced each year for, say, a 16-month system, that could cost up to $250 a day for extra finishing time. So let's say £75 we've now got loss just due to this kind of low grade, kind of chronic weight loss. And if you also get a carcass downgrade because of that, then let's add another £25 on for that, and you're easily talking £100. So I think £100 is not an unreasonable estimate of what it costs to have that kind of just very sort of low grade weight loss over a finishing period. So then if you want to try to put some figures on what an outbreak might cost in springborn, say, suckle calves, this is the kind of cattle I was used to dealing with a lot. So let's say you had 100 springborn suckle calves that were going into a 60-month finishing system. You get an outbreak of respiratory disease when they're around about weaning, let's say about 300 kilos at the time of the outbreak. 2% mortality, that's 2 animals dead. That's obviously pretty bad news, but that is a very expensive part of the cost. Let's say half of the calves in the outbreak require treatment, and that isn't unusual in the kind of unit size we look after. We'd often make a decision to go and treat maybe half of the group or even a whole group. So if we say the treatment cost for that size of animal is going to be around, I would say, £40 a head, but say that's going to give you another £2,000 onto the cost of that pneumonia outbreak. That's just your treatment and death, but this is the significant one. If we then say half of the treated animals, so of the 50 that we treated, let's say half of them, 25, experienced this a wee bit of residual lung damage, giving you this growth rate reduction, that £100 a head would lead to another £2,500 loss. So it adds up rapidly. And you can see there, this is the kind of costings that we can start to accumulate in severe or even moderate pneumonia outbreaks in beef cattle. And that obviously doesn't take into account any of your farm labour or stress involved in dealing with these outbreaks. So the point really I'm trying to make here is that if you then incorporate vaccine costs into your control program, the vaccines don't need to prevent 100% of disease losses to give cost benefit. You know, people often say, oh, the vaccine, it's expensive. Yep. But even if the vaccine could prevent, for example, the mortality, if it stopped these 2 calves from dying, or even one of them from dying, and reduced the numbers that you needed to treat, or reduced the damage to the lungs in the ones that were treated, it can quickly, you know, kick into cost benefit. So that's beef cattle. What about dairy heifers? And we know a lot now about the impact that pneumonia has in dairy heifers that goes right through their lives. So pre-weaning pneumonia, so a calf this kind of age that's suffering from pneumonia even prior to weaning, if these calves recover and end up as replacement heifers, we know that there can be significant losses incurred throughout their lifetime. And recently we put together this kind of cost, or you could look at it either as savings if you prevent it, or cost if you get the problem, for a dairy heifer calf, based on stuff that's been published in the literature over the last few years. So say we have a young pre-weaned dairy calf that gets pneumonia, you're going to have an immediate cost of treatment, let's say £40 for that cost. And then what we know is that calves that are treated with a significant degree of pneumonia as young calves, they tend to have obviously effect on their average daily gain. That kicks right through to delays in getting them in calf. So let's say a 2-week delay to age at first calving, there's a cost attributed to that, another £40, and some good work from AHDB in Northern Ireland, where they looked at the effects of dairy heifer calves that had pneumonia, looking at their yield reduction going forward into first and second lactation. And they worked out that the heifers that had been affected badly with pneumonia had 4% in the first lactation and up to 8% or more in second. So you start to add those costs in, and then you get to the biggest cost, which is actually reduced longevity. And this is work that's been produced by Alex Bach and replicated by others, where we know that if a heifer is affected with pneumonia, even as a young calf, even if she makes it into the milking herd, they seem more likely to go out prematurely. And it makes sense, because a lot of these heifers will just have a low-grade lung damage, and in a modern Holstein, high-yielding milking cow cannot perform fully with damaged lungs. They basically need their lung function to be 100% to run the metabolism that they need to produce. So I think this is what accounts for this reduced longevity. It's just their lungs break down earlier than you might be expected. So big potential losses in dairy heifers that are affected from pneumonia. So if we then try and put that into perspective and say, right, is the costs involved in trying to reduce or prevent pneumonia too high, then we need to look at what are those costs relative to the other costs involved in, say, for example, rearing dairy heifers. Now, some of you may have seen this work before. This was presented in a really good webinar, I think, last year, the results of this study. And you can see here that in this study, which was looking at the costs, input costs, just from birth to weaning of dairy heifer calves, you can see there that vaccination was attributed a cost of just under 4%. So it's not a massive part of the input costs to dairy heifer. So if you're looking at ways to reduce your fixed and variable costs, vaccination is probably not the first one to think of cutting if possible, because there's lots of other ways where you could probably shave off 4% off your input costs that would have less risk, to the calves than perhaps ceasing vaccination if that was a thing that you're already using. And if you look at it in the context of lifetime production costs, let's say even if we attribute a cost, what I'm going to call here a lifetime cost for a dairy heifer of, let's say, £25 for vaccination, maybe you vaccinated a very young calf and then you boost them maybe post-weaning when they're older, or maybe add IBR vaccine in. And if you look at £25 as a relative percentage of total rearing costs, only 1.4% of the rearing costs first calving, according to that recent survey. Or in terms of rearing costs, £3 a day is the cost of rearing dairy calves to weaning. It's 8 days of your early rearing costs. So if vaccination can, for example, even reduce days to weaning by a few days, again, it's got cost benefit. And not to forget the beef guys, if we look at and I know that these costings, some of you will say, well, these are not realistic for my farm, but these are just taken again from stock take costing. So this is a beef rearer finisher system. Total cost of production in this system, for the cow-calf unit, 982. Cost of vaccination for a beef suckle calf might be only, say, around £15 for maybe a 2-dose vaccine course. So it's a very small percentage of total cost of production. So again, as a way to reduce your production costs, vaccination is not going to make a big impact, but potentially could lead to significant losses. So I think to finish off the discussion on cost benefit, I would argue that vaccination or disease prevention for pneumonia can actually be quite a small percentage of your production costs, but it can deliver a large potential cost benefit. And I know that one of the things that we're focusing on in this season at the moment is reducing farm antibiotic usage, and without doubt, vaccine is a very effective way of potentially reducing your overall farm antibiotic usage, because in a lot of farms, the majority of antibiotic used is for calf pneumonia. So if you can find by preventing pneumonia, even reducing the number of cases and severity, you might have a big impact on your farm antibiotic usage, which is good for everybody. So that's a bit about cost benefits. Just going to move on now and talk about what causes BRD. And there's been other webinars recently on respiratory disease, and I think recently Colin Mason did a whole webinar just on Mycoplasma bovis. So you could talk for hours on the cause of BRD. So I'm just going to do this as a very kind of overview and not go into any detail. So this slide here you may have seen in different formats in the past, and it looks, again, highly complicated, and really it just demonstrates what we're saying here, that calf pneumonia is what we describe as a multifactorial disease. So there's no single cause. You've got a combination of viruses, and you might have heard of some of these before. RSV, PI3, BVD, and the IBR virus are all involved in the BRD complex. And then you've got all these different bacteria, and again, you may have heard of some of these, Mannheimia, used to be called Pasteurella hemolytica, Pasteurella multocida, Histophilus, and Mycoplasmas. And don't forget this one, at this time of year, there's definitely lungworm around at the minute, certainly where I live, in the south of Scotland. There's lungworm definitely active at the minute because it's been mild and now wet. And so the lungworm larvae will be hatching and active on the pasture. So coughing calves this time of year, don't forget your lungworm. So are there vaccines available for all these pneumonia bugs or pathogens? And the answer is no, not for all of them, but for many we have got vaccines. So we have vaccines against all these viruses, against some of the bacteria, but for some bacteria like Mycoplasma, Pasteurella multocida, we still unfortunately don't have commercial vaccines. There is vaccines against lungworm as well. So we've got the tools to fight these, or help fight BRD, but which are the ones you should focus on? So if you look at how common what we're calling these BRD viruses are in the UK, then these first two, RSV and PI3 virus, I would just say are what we call endemic. So all farms, as far as I'm concerned, in the UK have got risk of RSV and PI3. It would be very hard to find either a dairy or a beef farm in this country that didn't have risk of those two viruses. So they're just widespread and common. And this is results of blood testing that we do in Zoetis on farms where they've had calf pneumonia, and the vets take a sample of blood from the calves maybe a few weeks after the outbreak just to see what they've been exposed to. And this is the common finding. You're going to find RSV, PI3 pretty much on most pneumonia outbreaks. Whereas some of the other viruses, this is BHV1 is another name for IBR. So IBR, BVD, Mycoplasma are not on all farms. So you may actually have a farm that is IBR free, which is a nice position to be in, or you could be BVD free. And it's quite interesting if you look at the BVD incidence over the last 2 years. The nice thing is there seems to be a decreasing trend, and I think that will be because a lot of the samples that are taken in the scheme will be, a lot of them, or certainly at least half I'm sure, are taken in Scotland, and over the last 4 or 5 years the BVD control program is leading to a lot more farms now having BVD free or non-active status, which means you would be expecting to see a reduction in the involvement of BVD on a lot of our farms. Mycoplasma bovis, again, we're not going to talk in detail about that, but it could be increasing. It could be an increased awareness of that disease, but there's certainly not a trend for it decreasing. But again, some farms don't have M. bovis. They're M. bovis free, and some do. And the ones that do, it can become just another problematic bug in the pneumonia situation. So the bottom line with calf pneumonia is it's caused by a mix of viruses and bacteria. So what is really happening with calves that get pneumonia in most cases is it's a combination of virus infection that comes in through the nose, so they get challenged with these viruses. The viruses come into the calves. If the calves haven't got great immunity, the viruses can cause quite a lot of damage in the upper respiratory tract and down into the lungs. This is a picture of what we call the cilia, which line the lining of the upper respiratory tract and the windpipe. The viruses tend to damage this lining, which allows then the bacteria, which actually live quite happily in the back of the throat and the tonsils in healthy normal calves. These bacteria then will often start to multiply and actually get access to the lungs because the calf's natural defenses have been broken down. And then you end up with this. This is just a lung that you couldn't tell from these lungs, is this bacterial pneumonia or is it viral? It's probably a mixture of everything. Probably started off with a viral challenge. The bacteria really got hold of this lung, and this calf has obviously died from that severe pneumonia. So that's really what's happening with calf pneumonia. It's a mix of viruses and bacteria. So which vaccines should you choose? And this is really where it's what we call a risk-based decision. So you need to discuss this with your own farm vet. It's part of your health planning discussion, because some of you, for example, won't have IBR, and maybe you don't have IBR risk. Maybe you've got closed units, and it could be you don't need IBR as part of your vaccine program. And the same with BVD. On farms that are now BVD free and they've gone to the trouble of removing that virus, it could be you don't need to incorporate BVD vaccine in your calves, perhaps, to reduce risk of that. But again, it's risk-based. You need to work out the status of these viruses for your farm and have the discussion with your vet. But what we can say is pretty much all farms have got risk of what we call these common pneumonia viruses. So the RSV, PI3, Pneumonia, they're pretty much on all farms. So the take-home message on the causes of calf pneumonia is it's what we call a true multifactorial or multi-pathogen syndrome. There is going to be no simple fix, is the bad news. We're going to come on to some solutions in a minute, but it's never going to be simple to prevent all pneumonia because of all the different factors involved. So we've talked about, the cost of pneumonia, we've talked about what causes it. Now I'm just going to run through what I'm calling this 3-point approach to how you might tackle pneumonia on your farm. So I think you can apply this to beef farms, dairy farms, and if you've got a pneumonia problem on your farm that it's frustrating you, then I think these are the 3 aspects that you need to focus on with your vet and your advisors to try and make a difference. So number 1, we're going to talk about how you can maximize what we're calling passively acquired, which is colostral immunity, and innate immunity, and I'll explain in a minute what the calves' innate immunity is. Number 2, you need to boost the acquired immunity of calves. So calves are born with no natural immunity. They get some from colostrum to start with, but when that goes, they need to acquire their own immune protection. And what you can do to help them is to boost that with vaccines. And then number 3 is to look at the ways of reducing the pathogen load or challenge on the farm. So what do we mean by innate immunity? If we're saying how can we maximize the innate immunity of beef and dairy calves, and what I mean by innate immunity is really a calf that it would be described as a robust, a resilient calf. So it's a calf that has got good nutrition, trace element balance, a calf that's not full of parasitic burdens, and it's a calf that you're helping to protect its natural upper respiratory tract defenses. So the innate immunity defense, for example, in the upper respiratory tract, is these cilia and mucus and things that are produced in the calf's windpipe that help clear these bugs and bacteria from the environment that it's breathing. So to help protect the calf's innate immunity, you need to provide clean, fresh air, remove dust and fumes, don't blow young calves, for example, straw blowers in young calf pens, because it will just fill their windpipes and their upper respiratory tract with dust. Protecting them from extreme weather and temperature variations, that will affect their innate immunity. And then minimizing management stressors. And again, you've probably heard all this talked about before. You've got to wean calves at some point. You've got to castrate and dehorn perhaps. You've got to transport them and mingle and mix them. But you can plan how you do these things and try and minimize the stressors involved. So that's what we mean by maximizing the calves' innate immunity. And then what about maximizing their passively acquired immunity? And again, there's been plenty of webinars on this, so I'm only going to mention this in one slide, but it's all about colostrum, good quality colostrum, enough colostrum fed quickly and hygienically. And after colostrum, it's about boosting protection with vaccines. So just, again, to put it in a sort of pictorial sort of representation, how does calf immunity work? So let's take, as an example, IBR immunity in a calf, and you could replace IBR with any of the other respiratory viruses. So let's say we've got a calf that's born to a mother who's protected against IBR. So the cow's either immune, she's been vaccinated, or she's come across this virus before. So that calf is initially born with absolutely no protection to IBR, but once it's suckled colostrum or been fed colostrum, it gets a good boost of antibodies into its body, which will last variable length of time, probably at least 3-4 months, and maybe up to 6 months. So calves that get good colostrum from a mother that's immune against IBR, they get protection. This is why it's actually, I think, quite unusual to see severe IBR in young calves, and it's because most of them have come from dams that have probably had exposure to IBR, so they get colostral immunity. But if you then turn that calf out, excuse me, to grass, then it's very unlikely to come across a challenge with IBR when it's at pasture. So as that immunity wanes, the colostral immunity, by the time it's coming in to housing, roughly say 5-6 months of age, it's now completely at risk. All its protection is gone, so it's potentially going to be weaned and housed with zero immunity to IBR. or RSV if we're talking about that virus. So now you're getting to this stage, it's colostrum antibodies are gone, and this is where vaccines come in. So the plan with a vaccine is vaccinate before the risk period, which means you then boost the protection of antibodies to that virus, in this case, let's say IBR. So if that calf then comes across a real challenge with wild IBR virus, maybe say a month after housing, it's protected. What happens is that calf's immune system is primed, so it kicks up antibodies and immediately starts to tackle that virus that's infecting it here. So it's in a much better situation than a calf that has not been vaccinated, whose immunity status would be here. So when it hits the virus challenge, it takes time for that calf's immune system to recognize that it's being attacked and to try and fight it. So vaccination is always going to be better than no protection. So that's boosting the acquired immunity, and then lastly, reducing the pathogen load. How can we do that? Again, just practical things you can do on the farm. This is why we talk about removing calves from cows as soon as possible and housing them in separate air spaces. It's because the cows and the older cattle are the source of these viruses. So you can reduce the risk of young calves being exposed just by getting them away from adults. Now, it's not possible in all situations. Obviously, autumn-born suckle calves, you can't do that, but with dairy calves, you definitely can. Removing the pathogens from the environment, that's where your good building design and ventilation comes in. So a building that's working effectively, where there's plenty of air inlet, fresh air coming in, heating up, leaving via adequate outlet, that actually acts to remove viruses and pathogens from the air. So it cleans the air and just makes infection less likely. And then group vaccination also reduces virus shedding. So if you have a whole group of calves that are vaccinated, if they do get a challenge, then you reduce the overall excretion of virus into that airspace just because the calves' vaccine immunity is kicking in quickly. So to finish then, we're going to look at a couple of examples of how we could apply that kind of three-pronged approach, I'm going to call it, into real life. So let's first look at a dairy calf example. So BRD and group reared dairy calves, and I don't know what the split of beef or dairy farmers on the webinar tonight is, but I would say this is the biggest single challenge in dairy calf rearing, is this system of group reared dairy calves on automated milk systems. So why is that such a challenging system for pneumonia control? Well, several reasons. You've got constant additions to the group, so hygiene is it's very hard to keep this a hygienic system unless you've got the ability to completely clean and disinfect between batches. But unfortunately, with a lot of farms, if you're calving all year round and you've got less than 150 cows, for example, you don't have enough calves being born to populate these pens quickly. So you end up with a trickle in of calves that are coming into this pen that might be 7 days old, up to calves that are maybe 6-8 weeks old, before they're weaned out. So you get this constant mix of younger and older calves, which is not good, and also very hard to keep clean. You've got colostrum issues with this category of calf, whether they're dairy reared beef or dairy heifer calves. Mycoplasma bovis is a problem in this type of system, because if you do have this on your farm, when you're feeding from automated feeders, it just spreads very easily. In any group system, it will spread very well. Diseases like coccidiosis, crypto, again, they're going to be a problem in group reared systems. Cold stress, poor air quality, again, if you keep dairy calves within the same airspace as adult cows, even if they're in separate pens, they're not going to be breathing clean air. They're going to be breathing air that's potentially got viruses from the adults. So plenty of challenges in the system. So how do you apply the kind of three-point approach we talked about? So let's break it down. First thing I would be doing in this system would be reviewing the colostrum protocol and monitoring how you're getting on with it. And there's some really good systems. Some of you have maybe used these, the Colo Quick system or the Perfect Udder, where you can identify cows that have got the best quality colostrum, freeze that colostrum, maybe even pasteurize it before you freeze it, and then as calves are born, snatched away from cows and fed high quality colostrum quickly, 3 to 4 litres. And once you've got that system in place, you can monitor it, looking at the total protein levels maybe in some calves. The vet can blood sample a few calves on routine visits, check that for you, and also monitor your colostrum quality. The second thing I would do to look at this kind of system would be review the nutrition on the farm, and this is all to do with innate immunity. What we know is that young dairy calves especially, if you underfeed them, so I would say any dairy calves that are growing at these kind of daily live weight gains here, 400, 500, 600 grams a day even, these calves are probably not being fed enough to express their true potential and also their growth potential. And we know that if calves are being fed what we might want to call an enhanced level of feeding, that does appear to improve their overall innate immunity. Excuse me. So feed your calves well, and if you get them to this kind of growth rate and above, you'll find that I think they just tend to be generally healthier. Another little pet hate of mine is calves not being given a supply to clean drinking water. And I've been amazed at going to dairy farms still where for whatever reason, pre-weaned calves are not getting free access to clean water. And it's been shown it's just a critical component of rearing dairy calves in any system. They should have clean water. It doesn't reduce their growth rate or their dry matter intake. It does the opposite if you don't give them water. Okay, and then the third point, boosting their adaptive immunity. This is where vaccines come in. So with young dairy calves, you can start vaccinating with against these pathogens like RSV, PI3, Mannheimia, as young as 9 days. Depending on the type of vaccines you're using, you can start from 9-10 days. So again, you just need to plan that with your vet when you want to start your vaccine program and which vaccines you're going to use. Group reared system, how can you reduce the pathogen load? And this is challenging, and some farms have actually considered using pasteurizers. So for example, if you know you have Mycoplasma bovis, one of the only ways actually to reduce or break the cycle of infection for that is making sure that the first milk or colostrum that you feed the calves is not contaminated with Mycoplasma, and pasteurization is quite an effective way of reducing that risk. Can also obviously help with Johne's control. But really it's about just reducing the concurrent diseases, forming groups quickly, closing them down, being able to depopulate and deep clean pens. And I think if you can't do that, it's really hard to rear calves well in these group reared systems. And then improving the environment, what does that mean for this type of system? Well, what it means really is, again, you've had webinars on this before at AHDB with people like Jamie Robertson. It's all about providing clean, fresh air, because that will reduce the risk of calf pneumonia in these systems. Dry deep bedding, to avoid cold chill and avoiding drafts. So these are all things I say that have been dealt with in more detail in other webinars. And then lastly, not to forget the beef calves. Let's take an example of beef calves. What are the challenges that many of you are facing with your beef calf systems? And if you're purchasing weaned calves that have come through markets, then there's no doubt that you can be in a high risk for getting pneumonia problems. So these are the challenges, abrupt weaning and transport. This is an interesting one. A lot of weaned suckle calves will actually be naive at the time they go to sale, because they've been born maybe from mothers that have given them colostral protection, but that colostral protection is gone by the time they're weaned. And a lot of these beef calves may come off farms where they don't have IBR, and maybe they don't have BVD, so they end up going to market with completely naive, exposed animals. They end up, maybe in poor quality housing, maybe overstocked. IBR, I don't know if everybody's seen IBR. I'll just run this video just so that you see what a calf, if you haven't seen it with IBR, looks and sounds like. And you can actually obviously hear the breathing of that calf, because IBR attacks the upper respiratory tract. Now IBR, again, a big risk for this type of system. Any calves going through markets that have got no immunity to IBR, they're at high risk. So IBR vaccination should be the minimum that these calves receive. So solutions for the beef calves, preconditioning is what the Americans call this prior to sale, and that really just means getting weaning done well before sale time, introducing them to creep feed, clearing out parasites, lungworms, BVD, PI cattle. You know, luckily we're well down the road now in Scotland to eradicating BVD. It's not easy, but it can be done. And what it means now is that if you go to a market and buy calves in Scotland, there should be no PI calves in that market, and that's a big advantage to know that you're not buying in a calf that could potentially be one of these BVD PI calves, which comes home then with the rest of the cattle and causes all sorts of problems. And vaccinating prior to sale, the Sure Calf scheme is a scheme that we've tried to get going for years, where we try to persuade farmers to vaccinate prior to sale. That is definitely going to help. Okay, the last pretty much slide, because I'm running a wee bit over the 40 minutes, I said I would do. Treatment of respiratory disease. If you see a calf like this calf has got chronic suppurative pneumonia, and this to me is failed treatment. So just one slide on the treatment of pneumonia. If I had to just give one simple message, it would be this. The key to pneumonia treatment is early identification and effective first-line treatment, and that is exactly the same as dealing with mastitis in dairy cows. If you can identify it early and treat it well the first time around, you've got a really good chance of treating pneumonia effectively. If you either treat too late when the calves have already got significant damage, if you underdose with antibiotics or don't dose for long enough, or in some cases use the wrong antibiotic, because not all antibiotics are effective against all the bacteria that you might have on your farm, then you can end up with lungs like this. This is what we call chronic suppurative pneumonia, and when you have a calf with this type of pneumonia, nothing, I'm afraid, is gonna cure it. So it's a waste of time just continually spending money treating these calves when they get to that stage. So, summary, promise this is the last slide, and then we get some time for questions. This is how I would approach BRD on your farm. So if you're having problems, then this is a way, I think, a good way to look at it. Think of ways you can maximize the innate immunity of the calves in your farm or in your unit, and these are all the things that can be involved in that. Consider boosting the acquired immunity of the calves with vaccines and reduce the challenge, and that's focusing on building design, producing clean fresh air, keeping humidity low, age groups, all these things. And vaccinating also does help reduce challenge by just reducing the amount of virus that will circulate in a group.